Well, joining us now to discuss, to talk to us about the strike and the grievances is the president of the National Association of Resident Doctors, Aliyu Sukumba. It's good to have you join us. He joins us from Abuja. Thank you so much for joining us, Doctor. Well,
thank you very much for having me.
Yeah, one would ask, at this time when we're facing a pandemic and, of course, battling some other infectious diseases, how justified would you say is this industrial action at the time you're most needed?
Thank you very much. Just as you have rightly said, you recall that on the 15th of June, we had embarked on a nationwide strike, which was suspended on the premise that the government as well as other stakeholders were going to address our concerns. Unfortunately, these concerns have remained unaddressed. And these concerns, unfortunately, I'm getting to hear from you that His Excellency, the Minister of Labour, has stated at some point that he has addressed 6 out of the 8 demands. Well, I beg to differ. The concerns have remained largely unattended to and are basically attended to on promises. The National Assembly at one point has intervened and made provision for the residency training funding for our program, and since then it has remained in the budget. It has not been implemented. The life insurance policy, again, we have been told that insurance companies have been contracted and have been paid to provide this life insurance for our members. Again, that has not translated to our members getting covered. So basically, everything we have sought for has been addressed at the level of newspaper and at the level of media coverage. It has not translated to anything tangible to our members. So basically, that's the concern about the demands he claimed we have been addressed in the past. Again, we have had a reason to have a meeting on the 20th of August to review how much progress we have made with regards to our demands, and that meeting never held. 13 days now since we were supposed to have that meeting, so we have not had that meeting. People were invited and the meeting never held. So I don't understand the negotiating table the Honorable Minister of Labour is talking about. So by and large, our demands, for which we embarked on strike on the 15th of June, suspended to give government time so that these concerns can be addressed. We gave government 10 weeks to see that these concerns are addressed, and unfortunately, to demonstrate the insincerity of government, these concerns have remained unattended to, and we have no cause, no other reason other than to proceed on the indefinite strike, which commenced 2 days ago, because, of course, having exhausted all other means of getting these concerns addressed and to no avail.
But I'd like to ask you, are you not concerned about the patients now? Because while the strike is ongoing, there are persons who will be affected by this action, which are Nigerians, the common man on the street.
Well, sadly so, but I need to remind you that resident doctors are not the only group of doctors in Nigeria. We have another group of doctors called the consultants that belong to the Nigerian Medical and Dental Consultant Association of Nigeria, and they are not on strike. We also have private practitioners, they are not on strike. This decision to embark on this strike was a painful one. That is why it has persisted, and we had to wait 10 weeks after the initial strike we embarked upon to resume this strike. It's a painful one, and we are unfortunately have to embark on this strike because we have no other source of getting our concerns addressed after exhausting all means of getting them addressed to no avail. And you also recall that if government has any interest of and concern for Nigerians, our concerns are not concerns that are beyond the reach of the government. We are only asking that we should be covered, our life insurance should be covered. We are only asking that our program, the residency training program, which is a time-bound program, be funded, and we are only asking that our hazard allowance that has remained 5,000 naira per month, that's less than $12, be reviewed. So basically, these are the 3 things we are asking, and the government has paid little to no attention to them. And that is to demonstrate to Nigerians that this is the level of premium the government has placed on the lives of Nigeria. You can imagine, this is the 2nd day into our strike, and we are just getting to know that the reviewed meeting that was supposed to hold on the 20th of August that never held has now been scheduled for tomorrow. So that goes to tell you how sincere and how serious government is to see that our concerns are addressed.
I'd like to ask you that, are there any plans to shift grounds, or should I say, what is the minimum acceptable condition that you are giving the government before you resume?
Yeah, we have just told them over now. But unfortunately, these are demands are not demands government is contesting. They are demands government have come to terms with and have agreed to implement, but because of the insincerity, again, they have failed to implement. We are only asking that we should be provided with life insurance, which government has stated repeatedly that insurance companies have already been paid for that. So what is the government's, what is it, why is it taking government this long to get the insurance companies to pay the death in service benefits to the next of kin of our members that have died? So far, we have lost 14 doctors to COVID alone just this year. We lost 9 doctors to Lassa fever again just this year. So why is government taking all the time in the world to tell these insurance companies after having paid them to pay the beneficiaries, the next of kin of these deceased members? So these are demands that, if actually the government is there, are demands they can address in a twinkle of an eye. We've also asked for the residency training funding to be provided. You recall that the Speaker of the National Assembly has stated time without number that they have captured the residency training funding in the budget. Again, if government is sincere, what will it take government to see that these funds are released after it has been adequately provided for in the budget? And then we have also asked that the COVID hazard allowance, which government has promised, which they have only paid 6 out of 54 federal institutions. I repeat, 6 out of 54, that they should conclude the payment. Again, this payment is just for the month of June, and we are ready to just let go of the rest so that we can move on and in the interest of providing care for Nigerians.
President of the National Association of Resident Doctors, Aliyu Sukumba, thank you so much for joining us on TVC News at 1.
Thank you for having me.